So good morning everyone. In this video, our students of B.Sc Operation Theatre Anesthesia Technology of second year students are going to discuss about patient case study based study on following infections like wound infection, respiratory tract infection and urinary tract infection. So they have taken a patient case study from each infection and they are going to present their answers in their point of view. So let's get in the video.
Good morning everyone, I am Mithra from the Department of Operation Theatre and Anesthesia Technology. I am here to give a case study on the topic of wound infection. Wound infection occurs when the bacteria enter into the burn wound and start growing. The wound infection occurs in all age of people. It will damage the skin and surrounding tissues. Now we are going to see the patient history. The name is Mithra, age 45 years, gender female, chief complaint, pain, swelling and pus discharge over 5 days. History of patient illness. The patient had a cut on the right leg while she is on work. History of patient illness. The patient had a cut injury on the right leg while working in the field 10 days ago. Initially, it was a short wound, but due to improper cleaning, it became a severe wound. Pain and swelling around the wound. Patient medical history. No asthma and hypertension, no diabetes for 5 days. Clinical manifestation. Redness around the wound, swelling, pain, tenderness. Physical examination. The temperature is 38.5 degrees Celsius, blood pressure 130 by 80 mmHg, wound size 5 cm into 3 cm, pulse 96 minute. Investigation. Complete blood count. Increase WBC, white blood cells, wound culture, presence of bacterial infection, blood sugar, elevate glucose level. Diagnosis. Infection wound, bacterial wound infection, medical management, antibiotic or prescribed, pain relief medication, regular wound cleaning and dressing, blood sugar level, adequate nutrition and fluids. Complications. Sepsis, tissue damage, spread of infections. Health education. We should keep the wound clean and dry. We should wash our hands before touching the wound. Wash hands before touching wound. Complete full source of antibiotics. Control diabetic properly. Conclusions. Wound infections are delay on healing and cause serious complication if untreated. Early diagnosis, proper wound care, antibiotic and hygiene are important for recovery and prevention of further infections.
Good morning everyone. I am Durga from the Department of B.Sc Operation Theatre and Anesthesia Technology second year. Today I am going to present a case study on pneumonia, which is lower respiratory tract infection. Pneumonia is an infection that affects the lungs and causes inflammation in the alveoli or alveolus. These sacs may fill with fluid or pus, making breathing difficult. Pneumonia may cause by bacteria, viruses and fungi. Now, let us discuss the patient's case. The patient is Mr. Ravi, a 58-year-old male who was admitted to the hospital with complaints of fever, persistent cough, sputum, chest pain during breathing and difficulty in the breathing for past 1 week. On taking medical history, it was found that the patient had been smoking for more than 20 years and also had chronic obstructive pulmonary disease. Smoking or COPD are major in risk factors of lower respiratory tract infection because they reduce lungs defense mechanism. During physical examination, the patient had temperature of 101 degree Fahrenheit, rapid breathing and observed where cracking sounds were heard in the lungs during auscultations. For the laboratory diagnosis, sputum samples were collected for microbiological examination. Blood investigations showed increased white blood cell count and elevated C-reactive protein levels, including infections and inflammations. Chest X-ray revealed in the lungs which confirmed pneumonia. Based on the clinical features and laboratory findings, The patient was diagnosed with community acquired pneumonia, also known as CAP. Treatment was started immediately. The patients received antibiotics such as amoxicillin to control bacterial infection. Oxygen therapy was given to maintain proper oxygen saturation. Antipyretics were administered to reduce fever, and the patient was advised to take adequate fluid and rest. After a few days of treatment, the patient's symptoms improved gradually. His fever reduced, breathing became easier, and cough decreased. This case highlights the importance of early diagnosis and treatment of pneumonia. Preventive measures such as quitting, smoking, vaccination, maintaining hygiene, wearing masks, and avoid exposure to pollutants can reduce the risk of respiratory tract infection. In conclusion, pneumonia is serious respiratory infection that can become life-threatening if untreated. Proper diagnosis, antibiotic therapy, and preventive care play an important role in patient's recovery.
Good morning everyone, I am B.K. Monica Shri. I am studying in SNS College of Allied Health Science, the Department of B.Sc Operation Theatre and Anesthesia Technology. Today I am going to present a case study on urinary tract infection, commonly called as UTI. Introduction. Urinary tract infection is an infection that affects the part of urinary system such as kidney, ureter, urinary bladder and urethra. It is commonly caused by bacteria, especially E. coli. UTI is commonly in women than men. Patient details. Name: Mistress Catherine, age 35 years old, gender female, occupation teacher, date of admission in the hospital 10 May 2026. Chief complaints. The patient came to the hospital with burning sensation during urination, frequent urination, lower abdominal pain, fever for 2 days, cloudy and foul smelling in urine. History of present illness. The patient was apparently normal 5 days back. Gradually, they developed pain and burning sensation while passing urine. Later, she developed fever and increased frequency of urination. So she came to the hospital for the treatment. Past medical history. No history of diabetes, no hypertension, no previous surgery. History of previous UTI 1 year ago. Physical examination. Temperature 101 degree Fahrenheit. Pulse rate 90 beats per minute. Blood pressure 120 by 80 mmHg. Mild tenderness in lower abdominal pain. Investigation. Urine routine examination. Urine culture test. Blood test. Findings. Presence of pulse. Findings. Presence of pus cells and bacteria in urine. Positive urine culture for E. coli. Mild increase in white blood cells. Treatment. Antibiotics as prescribed by doctors. Antipyretics for fever. Increased oral fluid. Proper perineal hygiene. Complete bed rest. Nursing management. Monitor vital signs regularly. Encourage plenty of fluids. Maintain intake and output shot. Administers medications on time. Educate patient about personal hygiene. Health education. Drink 2 to 3 liters of water daily. Maintain proper genital hygiene. Avoid holding urine for long time. Wear clean cotton garments. Conclusion. Urinary tract infection is a common but treatable condition. Early diagnosis, proper treatment and good personal hygiene help in preventing complaints and restlessness. Thank you.